My name is Riona Sayers. I'm a Herd Health Research Officer working with Agric Teagasc in Moorpark, and I was going through biosecurity with the farmers here today and literally what steps that they could put in place to minimise disease risk during herd expansion. And herd expansion is really, it's a time that there is a lot of extra disease risk on farm, and there are also risks to, that there are poor welfare practices on the farm. So I suppose when most of us think of herd expansion, farmers literally, and the rest of us, we're thinking more cows, more milk, more money. What I have to look at on the other side is there's an increased disease risk, there is probably less attention to welfare, and all of that can lead to less money. So you've got this balance between both of them. And the main reason that that happens is you're going to have, if a farmer is expanding, obviously the quickest way to do it is you're going to purchase cattle. So if you're purchasing cattle in, you're going to leave yourself a lot more open to bringing new diseases onto the farm. Also what can happen is, because we've such fragmented farms in Ireland and we are also getting into contract heifer rearing, there's a lot more cattle movement, and that increase in cattle movement also increases disease risk. And the final one is, if you've got increased number of cows, you need increased labour, or you might bring in new management systems, and all of that. If you've got new systems on a farm that may or may not be either resourced correctly, or they don't have the correct amount of resources, this will all lead to increased disease risk and poorer welfare. So what I was looking at were just steps. I've literally outlined in the programme that I went through today was just steps 1 to 10, that if you were purchasing cattle or you wanted to minimise disease risk to the farm, what were the steps that you'd look at? So essentially, just to summarise a few of those, the most important ones would be minimising the purchase of animals, and if you were going purchasing, that you would implement quarantine, diagnostic testing and vaccination. Very, very important to do the 3 of those together and not just rely on vaccination alone. It's very important to underpin it with some diagnostic testing. And it's also really, really important before you purchase animals that you need to know your own herd status. Obviously, and it sounds simplistic, but you need to match diseases of the animals you have, of the diseases you may have in your own herd, plus the animals that you're buying in. So if you have an IBR negative herd, you want to buy IBR negative animals. If you've got an IBR positive herd, you may not necessarily want to buy IBR positive animals, but if you buy IBR negative animals, you must vaccinate them. So again, you just need to mix and match. Other things that I was looking at, that if you were purchasing or even newly introducing animals that may be on a different land parcel on the farm, to make sure you dose them for parasites and foot bath them for infectious causes of lameness, because they can bring all of these with them. And when we think of infectious disease, parasites and lameness often get forgotten about. So they are 2 very, very important ones. And again, it's very important if you're purchasing or designing any of your strategies for disease control or minimising your disease risk on farm, have your vet, have your advisor, have as many people as you can involved in the process. And that just ensures you've got 2nd, 3rd, 4th opinions. And again, put a plan together and strategically plan how you're going to do your expansion, and it should seriously reduce your risk of having disease on farm. In terms of what awareness farmers would have about biosecurity during a herd expansion, back in 2008, when I would have started with Moorpark, I would have said farmers' awareness of biosecurity was relatively poor. Besides big disease outbreaks like foot and mouth, it was not something that farmers felt they had to implement on a daily routine basis on the farm. That has very much changed with Teagasc programs, Animal Health Ireland, ICBF, the Department of Agriculture. There's a lot of stakeholders come together over the past number of years. Awareness of biosecurity has improved, probably still not at a level that we would like. And especially, I think it's very, very important for farmers just to realise that extra disease risk when they are expanding the herd above the norm. Again, if you go over, and it's been shown in numerous studies internationally, once you go above 100 cows, so again, if you change absolutely nothing else except increase your numbers to over 100 cows, you are automatically at a greater disease risk, especially from viral diseases like BVD and IBR. So again, there is still a job of work to be done in increasing awareness, but I think we've definitely laid down a very good foundation for 2015, and it's a case of actually supporting all the different stakeholders to keep supporting that expansion.